Inside the School, the podcast where we explore the tools, technology, and techniques that keep modern surgery running safely behind the scenes. I'm your host, Basani, and today we're diving into one of the most fascinating and honestly one of the most misunderstood areas of surgical instruments, arthroscopy. Arthroscopy is a minimally invasive technique used to diagnose and treat joint patients. But while the incisions are small, the instruments behind the procedure are anything but simple. Today's episode focuses on a major issue in arthroscopic instrumentation: hidden soil and internal contamination in shaver handpieces and reusable burrs, and how sterile processing and OR teams can solve it using evidence-based practice. The issue: hidden soil and internal contamination. Let's talk about the problem that sparked FDA alerts, AARN's discussions, and countless SPD in service. Internal contamination is arthroscopic shaver handpieces. On the outside, these instruments often look perfectly clean, but the inside, studies have shown, retained bioburden, tissue fragments, bone dust, dried blood, rust or corrosion, even microbial growth. And none of these is visual without specialized inspection tools. There have been documented cases where shaver handpieces pass through decontamination, assembly, and sterilization and still contain visual debris once a borescope was used. Why this is happening? Design complexity. Arthroscopic shavers contain narrow lumen, rotating internal blades, gears, channels that curve or taper, and components that cannot be disassembled. This means traditional cleaning methods, brushing, flushing, and ultrasonic cleaning, may not reach every surface. Inconsistent IFUs. Different manufacturers require different brushing, detergent, soaking time, automated washer cycles, drying methods. If staff don't have the correct tools or training, contamination becomes almost guaranteed. Lack of internal inspection tools. Many facilities still rely on visual inspection alone, but you can't inspect what you can't see. Without borescopes, internal contamination remains invisible. High turnover pressure. Arthroscopy is common in orthopedics, which means instruments often have fast turnover times. Rushing increases the risk of incomplete cleaning. Evidence-based solutions. Now let's shift into solutions, the part that actually empowers SPD and ORT. Mandatory borescopes inspections. AAMI ST91 recommends borescope inspections for all lumen instruments. This is the single most effective way to detect hidden soil. Facilities that implement borescope programs saw a dramatic reduction in retained debris. Strict IFU compliance. IFUs aren't suggested, they're legal requirements. Facilities should keep updated IFUs accessible, train staff on manufacturer-specific steps, use correct brushes and adapters, document compliance for quality assurance, enhance staff training, annual competence should include disassemble steps, proper brush techniques, inspection of shaver handpieces, troubleshooting common issues. Hands-on training with vendor reps is especially valuable. Vendor collaboration. Manufacturers can provide updated IFUs, in-service training, replacement parts, demonstration of proper cleaning. This partnership reduces guesswork and improves safety. Consider single-use options. Some facilities chose disposable burrs and blades to reduce infection risk and simplifying workflow. This isn't always cost effective, but it can be appropriate for high-class causes. Conclusions and key takeaways. Arthroscopy may be minimally invasive, but the instruments behind it are anything but simple. Their internal complexity makes them vulnerable to hidden contaminations, a risk that can directly impact patient safety. But with the right tools and training, SPD and OR teams can dramatically reduce the risk. The key takeaways are arthroscopic instruments require specialized cleaning and inspections. Hidden soil is a documented serious issue, not a hypothetical one. Borescope inspection is essential for lumen instruments. IFUs compliance and staff training are non-negotiable. Collaboration with vendors strengthens safety and workflow. Alright, since we still have time, we're going to talk about another topic. We have complex surgical instruments. Today's episode, to add on, we're going to be talking about the critical issue in complex surgical instruments, the hidden risks created by multi-component, difficult to clean instruments, especially powered and multi-part orthopedic tools, and how evidence-based inspection and cleaning practice can prevent patient harm. Complex instruments improve surgical precision, but their design also increases the likelihood of retained bioburden, mechanical failure, and sterilization challenges. Complex instruments such as power drills, saws, reamers, multi-part retractors, and robotic attachments contain internal gears, lumens, hinges, and removable components. These features make them effective in surgery, but extremely difficult to clean. One of the most documented issues involve powered orthopedic handpieces. These devices often contain narrow internal channels, rotating shafts, removable gears, electrical components that limit soaking or ultrasonic cleaning, multi-detachable parts that must be disassembled correctly. AORN and AAMI have both reported cases where powered instruments appear clean extremely but still contain bone, dust, tissue fragments, and dried blood inside their internal mechanisms. Once borescopes were used, this contamination is invisible without specialized inspection tools and can lead to post-operative infections, instrument malfunction during surgery, corrosion and premature equipment failure, delay or cancellation of procedures, and loss of surgeon's trust in SPD teams. AAMI, ST79, and ST91 emphasize that complex instruments require enhanced inspections, not just standard visual checks without proper disassembly and internal inspections. Contamination can remain even after automated washing and sterilization. Alright, we have solutions. Number 1, strict IFU compliance. Manufacturers provide detailed instructions for disassemble, brushing, flushing, and lubrication. AAMI and the FDA warns that failure to follow IFUs is one of the leading causes of retained bioburden in complex instruments. Mandatory internal inspections. AAMI ST91 recommends borescope inspections for lumen and multi-component instruments. Studies show the borescope revealed contamination that cannot be seen with the naked eye. Base staff training. Annual hands-on training ensures technicians know correct disassembly order, proper brushing and flushing techniques, how to identify wear corrosion and mechanical issues, how to document inspection findings. Vendors collaboration. Manufacturers can provide updated IFUs in service and troubleshooting guidance. This reduces guesswork and ensures SPD teams use the correct tools and detergents. Consideration of single use. Some facilities reduce risk by using disposable drill bits, reamers, and robotic attachments when appropriate. This eliminates cleaning challenges of most complex parts. Conclusion. Complex surgical instruments are essential for modern surgery, but these designs make them vulnerable to hidden contaminations and mechanical failures. Evidence shows that internal inspections, IFU compliance, and specialized training dramatically reduces these risks. We have takeaways. Complex instruments require more than basic cleaning. They require precision, disassemble, and internal inspections. Hidden soil is a documented risk that can compromise patient safety. Borescopes and IFU-driven workflows are essential for safe reprocessing. Collaboration with vendors strengthen SPD competence and reduce errors. Patient safety begins with the technicians who inspect, clean, and assemble these instruments every day. Thank you for joining me on Inside the Scoop. Reminder, patient safety starts long before the surgeon enters the room. It starts with us. I'm Dasani, and I'll see you in the next one.